Research Evidence-Based Nursing Practice Final Presentation Victoria K. Harriott, RN BSN, April 26, 2015. There is an influx of new nurse graduates entering the workforce every 6 to 12 months. Concurrently, there is an aging population in the nursing workforce, some of which are ready for or close to retirement. According to Hill, given the evidence we currently have regarding the relationship between nurse experience and quality of care, concern is being expressed over the number of nurses approaching retirement age and considering leaving the workforce. With this comes an increased turnover rate, which can be directly correlated to decreased quality of care evidenced by patient satisfaction evaluation. I began by formulating my PICO question based upon the issue of turnover. This was determined by asking the question, what causes nurses to leave their current jobs and what can be done to retain these nurses? One factor was workplace dissatisfaction and performance perception. These factors differed based upon the nurse's level of experience or years in the nursing workforce, which in turn brought me to my PICO question, which is as follows. What factors contribute to turnover rate, workplace satisfaction, and performance perception among new graduate nurses compared to experienced nurses with 2 or more years of clinical practice, and how does this affect quality and continuity of patient care? Let's start by discussing Patricia Banner's novice to expert nursing theory. Within this theory, Banner has identified 5 phases of clinical competence, including the novice, advanced beginner, the competent nurse, the proficient nurse, and the expert nurse. Banner believed that retention of the older experienced nurses was essential for the advancement of younger nurses to a higher level of practice and improved quality of care. This is proven when 2 nurses on different ends of the novice and expert continuum assess the same patient differently based upon their levels of expertise in nursing practice. The expert nurses are in the workforce as a resource to the novice nurses. Without the guidance and training of the expert nurses, there is a loss of experience-based knowledge in the clinical setting, which conveys ominous implications for patient care. The conceptual framework I chose to include in my research is not a nursing theory, but it serves a meaningful purpose to the topic at hand. The job embeddedness theory is described as on-the-job and off-the-job factors associated with individual links, fit, and sacrifice. Links are defined as the relationship between the employee and the institution for which the individual works. Fit is how the employee views his or her comfort level with the job duties and work environment. Lastly, sacrifice in this context is considered to be any benefit, material or emotional, that the employee would have to spare at the point in which during he or she decides to leave the establishment. The job embeddedness theory fits my PICO question because it consists of factors that contribute to the effectiveness of a nurse's job. It focuses on how to improve the worker's experience, which in turn will hopefully benefit the patient's experience because ideally they will be receiving care from an employee who is happy with their job. If a nurse feels valued by their employer and confident in their skills, then their performance should reflect this concept. I believe this theory, used in conjunction with Patricia Banner's novice to expert theory, could support that foundation of my PICO question. Let's first focus on turnover rate. Factors affecting turnover rate include burnout, workplace environment, scheduling, and money. Nurse burnout has been correlated to the stress of patient assignments on a day-to-day basis. Nurses are expected to provide an equal amount of time to all of their patients throughout the workday, which is defined as hours per patient per day, or HPPD. However, this task deems itself impossible if staffing is inadequate and the nurse-patient ratio is unevenly distributed. Having an increased number of patients as a responsibility for an entire 12-hour shift can be stressful and could cause an elevated level of anxiety. New nurses seem to view these assignments as overwhelming, which later causes them to seek employment where the staffing is more efficient for the patient population. Older nurses may not see assignments as much of a challenge, considering they are accustomed to the heavy workload. However, according to Letback, the physical demands of the job needed to prevent patient falls have been proven to pose safety risks for the patient. Therefore, it was suggested that those assignments be given to the younger, more average nurses. Scheduling and salary play an important role in turnover rate as well. Older nurses seem to prefer working shorter hour days, more days a week, because they require a little more time to recover following a day's work. Younger nurses are more inclined to work longer days and have more days off to accommodate a social life. Employees that are happy with their scheduled shifts are more likely to continue working at a facility and provide quality care. Some have even taken a pay cut in order to get a more preferable shift, which brings me to the topic of salary. Nurses believe that they should have a salary that is reflective not only of their value as an employee, but also reflective of their years of experience. With that being said, older nurses tend to make a small percentage more than less experienced nurses. However, this gives the new nurses incentive to continue to work at a facility with the expectations of increased pay after accumulating time and proficiency. Factors contributing to workplace satisfaction are centered around how the facility views its employees. They root from the question, do you feel valued by your employer and fellow coworkers? This factor alone can increase employee commitment to a facility. Research has shown that older employees demonstrate more professional commitment in relation to the time they have invested into the facility. Other areas of concern include the inclusion of the staff in decision-making process. Are my ideas and concerns being considered? Is there proper communication between staff and management and among nurses and support staff? Employees are more likely to enjoy their work if they feel as though they have an input in the decisions that are being made within the unit. Nurses also want to know that their employers are going to support their decision to seek continued education. This support is illustrated by financial assistance with tuition and time off of work for school. Having a unit educator is also beneficial. Unit educators provide the staff with the latest evidence-based practice research so that current quality care can be provided to the patient. Performance perception is very subjective. Self-esteem, according to the social learning theory, is a basic human need, and an individual's work role is an important source of identity. An individual's ability to perform significant work affects a person's perception of productivity. Nurses are continuously evaluating themselves and their work performance. Their perceived self-efficacy and professional competence have been directly correlated with level of education. Nurses with an undergraduate level of education had a higher perception of self-efficacy and nursing competency. So to answer the question, yes, education actually does matter. Education not only matters in reference to the nurse's self-evaluation, but it plays a role in how patients perceive the delivery and quality of their nursing care. As stated by Milutinovic, patient satisfaction is an important quality outcome indicator of healthcare in the hospital setting and nursing care. Quality of care is also measured by hospital-reported incidences such as number of falls, number of medication errors, and number of reported hospital-acquired infections. Units with high nurse staffing numbers and nurses with degree-level education had a direct relevance to the decrease in hospital-acquired infections. Also, increased nurse staffing, which correlated with high hours per patient per day, was directly associated with decreased patient falls, fewer medication errors, and fewer hospital-acquired infections. When comparing the quality of care between older nurses versus new nurses, one study found that there was no difference in the number of medication errors between the two groups. Nonetheless, the older nurses could not perform physically demanding tasks such as preventing patient falls, as previously stated. It was suggested in the study that in order to advocate for patient safety, it would be beneficial to assign the high fall risk patients to nurses without health issues or age-related physical incapacity. Although no physical or psychological harm came to any of the individuals included in the study, any research that utilizes a human sample will involve ethical issues. The first issue to consider would be autonomy and individual responsibility. Most of the articles I've reviewed chose to select a sample population utilizing purposive selection, and data was collected using surveys and focus groups. In doing so, much of their research depended solely on the participants' cooperation. This, in turn, could affect the research results because if only a small amount of participants fully participated in the study, then it might not be considered clinically significant. Each participant has a responsibility to completely participate in the research if the results are to be used to change clinical practice effectively. Without the full involvement of the entire study sample, or at least the majority of the sample, the research cannot be complete or might not be considered clinically significant to the researcher. Another ethical issue of consideration is equality, justice, and equity. My PICO question focuses on how the nursing staff's attitude towards their job and work environment affects the quality and continuity of patient care. In many articles that I have reviewed, it has been suggested that nurses must have a sense of confidence and comfort with their skills and workplace before they can provide quality care. In doing so, the facility must somehow supply their nursing staff with certain incentives to make this improvement. Many facilities do this by first implementing incentive practices in a specific unit in the facility for a trial run. This is a disadvantage to other nurses and patients in other areas of the organization because they could be receiving quality care, but instead they are receiving the same traditional care. However, once these incentives are proven to be effective, sharing of benefits should be implemented in other areas of an organization in order to provide fair and equal treatment for all patients. Participation in the study should be solely on a voluntary basis. Participants would be assured that their jobs would not be affected in any way based on the honest answers to their questions. Permission must be received from a Research Ethics Committee to use a specified questionnaire for results evaluation. Consent would be received from patients to use the answers to their questionnaires in the study. They will be guaranteed that there will be no consequences regarding their future care related to their answers. And last but not least, no nurses must be represented fairly throughout the study. Otherwise, the results are not significant to a wider population. This particular type of study would not need much funding for the basis of the study. However, interventions needed for desired results would require some financial support from organizations such as follows: the National Institute of Nursing Research, National League for Nursing, Agency of Healthcare Research and Quality, and also include the healthcare facility research funding. In conclusion, nurse turnover rate is affected by many factors, and in turn it can affect the quality of care that the patients receive. By providing employees with the proper training and education along with a relaxed and diverse workplace environment, nurse competency and productivity will significantly increase. Also, the retention of experienced nurses provides a knowledge base and resource for the advancement of the younger generation of nurses. Concurrently, patient satisfaction and quality of care will also increase. Thank you. That is the end of my presentation.